Hello, everyone, and welcome. The webinar will begin in just a second. I wanted to turn your attention to our social media pages. On Twitter, feel free to follow us at Reading by Third. On Facebook, follow us at the Campaign for GLR. Also, use the hashtags GLR Reading and hashtag Learning Tuesdays to share any thoughts that may come to you during this webinar. We will be sure to retweet. And once again, feel free to follow us at the Campaign for GLR on Facebook and at Reading by Third on Twitter. Okay, welcome again. My name is Sierra Sanchez, and I will be behind the scenes helping to produce this webinar. I just wanted to share a few tips before we got started. First, feel free to introduce yourself in the chat box. Please select both panelists and attendees so that we all know who is here. All attendees are in listen-only mode. Also, post your questions in the Q&A box. We will designate the last section of the webinar to respond to those questions that are posed, and feel free to post them throughout so that we can check on those throughout the webinar as well. The webinar is being recorded and will be made available to all who registered. And the webinar is being live streamed on Facebook as well. Lastly, we will have a brief evaluation survey posted during the Q&A portion. Please respond to that as it helps with our commitment to continuous improvement at the Campaign for Grade Level Reading. Lastly, I just wanted to turn your attention to a few of our upcoming webinars that we have with our GLR Learning Tuesdays webinars. They are often from 3 p.m. Eastern time, but we do have a few special webinars. Today at 3 p.m., Tuesday, October 13th, we have Telenovela as Teacher, Innovations with Univision, Too Small to Fail, and Literacy Partners. Next week, we have two at 12:30 p.m. and 3 p.m. First, it's Global and National and Still Local, the Bill and Melinda Gates Foundation in Washington State. Then we have Transforming Wellbeing Through Social and Emotional Development, Show and Tell 3. And lastly, on October 27th, we have two, Philadelphia, The Power of Collective Impact at 12:30, and Stepping Up, Federal Role in Advancing Digital Equity at 3 p.m. We hope that you will join us for these upcoming webinars, and we will post the link to register in the chat box as well. And joining you now is Jill to kick everything off for us. Thank you and enjoy the webinar.
Hi everyone, I'm Jill Fioravanti. I'm a senior consultant with the Campaign for Grade Level Reading, and I'm thrilled to welcome all of you and welcome our panelists and speakers to this really important conversation. This is the second second webinar that we've had on the topic of shared services. The first one took place on July 16th as part of an extended set of webinars that we designed for GLR Week, which was our annual conference that went virtual. And the richness of that discussion prompted us to want to continue this learning with the second discussion with a specific drill down on the role that technology can play and has played in supporting operational efficiencies that can really be gained from shared services. So just to provide a very brief bit of context, as everyone here knows, childcare is an essential ingredient to early school success, and in particular to preparing children to enter kindergarten ready to learn. As you can see from the title, the pandemic has really thrown the childcare sector into crisis, and there are a lot of proposals for what needs to happen to rebuild it, models for rebuilding, and how to pay for that. Our session in July provided a range of ways that states across the country were approaching shared services, some more established, some newer ventures, some not specific to states, but that are offered nationally. And we're really looking to continue this learning process with the second discussion on particularly the role of technology and shared services. We do have a few return guests who spoke at our July session, who you're going to hear from again as discussants in today's section, and we'll be introducing them as the session goes on. I'm really pleased to turn this over to our moderator, Chelsea Sprayregan. Chelsea is the entrepreneur in residence at Promise Venture Studio. She's an early childhood entrepreneur, as her title would imply, and a consultant Her work focuses on fair pay for caregivers and educators, effective government funding systems, sustainable childcare business models, and technology to support those goals. She has a really interesting background. We're going to be posting the bios of all of our speakers in the chat box, and you'll also receive a link to clip with that information. You had it before today, and you'll get it in the follow-up materials as well. So with that, I'm going to turn this over to Chelsea, and she's going to carry us through the next 85 minutes or so. Thanks so much.
Thank you, Jill. I'm thrilled to be moderating today's session, which, as you know, will focus on shared services and technology as a promising set of solutions to our nation's childcare crisis. So if you could skip ahead a few slides to the context slide. I want to take a minute to look at some facts to better understand the crisis that today's speakers are working to address. First, early care and education is unaffordable and inaccessible for most families in our country. As one indicator of that, the average cost exceeds public university tuition in 28 states. Second, early educators make only $23,000 per year on average, and that early education workforce is almost exclusively female, and approximately half of licensed providers are people of color. So it's not a coincidence that our country systematically undervalues this labor. These low wages lead to increased turnover, which compromises the quality of care that children receive. Yet our government does not invest in early care and education at nearly the same levels as other wealthy countries. So our country has long experienced overlapping crises of childcare affordability, access, wages, and quality, all of which are deeply tied to ongoing structural racism. And then the COVID-19 pandemic hit, which heightened all of these challenges even further. Across the country, 35% of childcare centers and 21% of family childcare programs remain closed. In an incredibly difficult time for our country and for childcare in particular, I'm excited to spend today's session lifting up some points of light. Shared services is one of the few tested strategies for directly addressing these crises by increasing the supply of high-quality childcare and raising educator wages. Supporting the scaling of shared services is one positive step that all of us can take right now. So for the rest of today's session, we'll have the chance to go deep on this movement and hear from folks who implement this work in the field every day. Next slide, please. Today's webinar has two parts. Part one will focus on scaling shared services, including lessons learned about the crucial role of technology and connections to child outcomes. Part two will focus on the role that state policymakers and local funders can play in supporting shared services. We'll be stopping for Q&A throughout the session, so I encourage you to drop your questions in the Q&A box as they come up. Section one's featured speakers are Sharon Easterling, a consultant at Opportunities Exchange, Shannon Katsourotis, CEO of Nebraska Early Childhood Collaborative, and Ariana Shapiro, a business mentor coach at All Our Kin. And in section two, you'll hear from me, as well as Sue Renner, Executive Director at Mirage Foundations. Next slide. By the end of today's session, I hope you'll leave with a deeper understanding of a few key points. First, changing business practices through shared services directly affects child outcomes. Second, technology is essential to changing business practices. Increasing the use of technology is an important pathway to scaling shared services. Third, states have an important role to play in enabling technology use at every level of early care and education, from providers to shared services alliances to systems. Fourth, philanthropy is essential risk capital. Philanthropists can start new shared service alliances and help states change their own technology systems. Next slide. So I'm excited to introduce our first speaker, Sharon Easterling. Sharon is a consultant with Opportunities Exchange, supporting community-based shared service initiatives. Among other experiences, Sharon brings to this work 25 years leading the NACCE affiliate organization in Philadelphia, the Delaware Valley Association for the Education of Young Children. Take it away, Sharon.
Thanks, Chelsea. I'm so happy to be with you today. I want to make sure my audio is okay because we had a last minute switcher. Okay. So next slide, let's jump right in this. So interestingly enough, today in the New York Times, there was an opinion piece about the fact that in this country, we have this kind of artificial split between school and childcare. The title of the article was, "If schools are closed, why is childcare open?" And the essence of the article is, you know what, folks? School plays a childcare role, and childcare is school and education. So we're starting with the premise that childcare is where most young children are spending their days in our country. And for the last couple of decades, we have been aware of and focused on the issue that those settings need to be high quality. And so we've been paying a lot of attention to pedagogical leadership. And we've developed a lot of systems around building curriculum, around coaching teachers, around assessing classroom quality. But we haven't paid the same kind of attention to the business side of childcare. And in our system, that's incredibly important because the business model is really broken. There's not enough resources in the childcare system. So our premise today is that we have to actually pay attention to both pedagogy and business leadership if we want to get to high quality. Let's look at the next slide. So here's our theory of change. Shared services has a direct impact and link to child outcomes. What's that pathway? Well, it starts with strong financial management. Shared services is a way to get us to strong financial management in childcare programs. And when that happens, we see that programs have improved revenue and decreased overhead costs. That allows programs to redeploy resources, financial resources, into teacher wages and compensation. And it also frees up time, particularly in small programs where the director is in charge of doing all of the business functions. If there's a back office support, the director can then redirect her time to supporting teachers and focusing on education. And that ultimately leads us to the skilled, stable workforce that we know leads to strong child outcomes. Next slide. So this is a model of what a shared service enterprise can look like. It can include both centers and homes. And in the box on the left, you see all of the functions that a shared service hub might provide, both in the way of marketing and pedagogical supports. Next slide. So I want to point out, this slide is here because I want to make the point that when we talk about deep shared services that have a big impact, we're talking about more than things like joint purchasing or joint discounts, right? We're talking about a pathway to systemic change. So deep shared services can address inequality, it can improve compensation, and it can stabilize businesses. And as we go through, we're going to look at how this framework leads to those outcomes. Next slide. So we're going to talk for a few minutes about childcare management software and how it can ultimately transform the business of childcare. Next slide. There are a lot of challenges with running a childcare business, whether you're a family childcare provider or a center. And by the way, most childcare centers in the United States are small standalone programs that serve about 60 kids. So having to perform all of those business functions can be a really overwhelming task. But some of the challenges you see listed here are things like billing and collections, managing staff-child ratios, maintaining full enrollment, and complying with a myriad of standards and regulations that childcare programs face. Next slide. So on the right hand over here, you see the diagram of the iron triangle of early childhood finance. This is an idea that was created and put forth by Louise Stoney, the co-founder of Opportunities Exchange, who says that everything that she's learned about childcare finance can be summed up in this simple diagram, that in order for a childcare program to be sustainable, they need to do these three things. They need to be fully enrolled, fill every seat every day, collect every dollar and on time, and ensure that the revenue that's coming in on a per child basis is covering the cost. It's a really simple diagram. It's a pretty complicated set of things to do. And technology, business technology, can help programs do those things more consistently. So let's talk about billing for just a second. Most childcare programs in this country are still collecting tuition through paper invoices, through checks, through cash. Think about all the time that it takes to perform that manually. When programs use a CCMS system to set up and invoice parents at regular predetermined intervals, they have parents pay online, their collection rate goes way up. We've seen it happen time and time again. And even for providers that are collecting subsidy, it's a pretty complicated task to upload the information and then to reconcile those subsidy payments. So automation is an excellent solution to help with this. Next slide. And there's my graphic that shows you. So just a little side note, Opportunities Exchange has worked with a lot of programs to help them become automated, and virtually every time we see a center begin to collect money electronically, collections go way up, bad debt goes way down. Next slide. Another challenge is right-sizing the classroom, staff-child ratios. We know that you don't want to be understaffed because that's not good for kids. But if a program is overstaffed, that can be really expensive. And it's especially important right now because enrollments are really fluctuating as programs, as parents are concerned about coming back to group care during this pandemic. So, next slide. Childcare management systems have tools to help directors manage staff-child ratios, where they can really be on top of making sure that they have the right configuration for the number of children that are in care. Next slide. Staying full. And it's not just an issue around the head count, but do you have children enrolled on a full-time basis every day? So, for example, having a few kids coming part-time translates into less than full enrollment. Well, CCMS can really help providers, again, stay on top of keeping programs full. Next slide. One of the ways they do this is by having online enrollment and waitlist management. So think about how much smoother the process of enrolling new children can be when a parent can find your program online. They can sign up to do a tour right there through an automated calendar schedule. They can complete the tour either on site or virtually, fill out the application. You can literally go from weeks down to days in the enrollment process when you automate those systems. Additionally, a lot of childcare management programs have a waitlist management tool that help providers, when they do have a wait list, stay on top of and stay in touch with families that are interested in enrolling. Next slide. And then finally, anyone who knows anything about childcare knows that there's a long list of things that providers need to do to stay in compliance, to meet their program and their funding standards. Being able to automate those, many of those reports and functions saves a tremendous amount of time. Next slide. So this is a chart that kind of estimates how long things take before a program has automation and then what can happen. And these numbers are, they're good guesses, they're guesses, but they're really good guesses because we've watched programs document these kinds of really, really big savings. So much so that they are able to, as I said, shift their payroll, shift their personnel budgets from spending really large amounts of money on administrative support into classroom teacher wages. Next slide. So we'll talk for just a minute about some of the challenges around pedagogical leadership. So there's child assessment, there's family engagement and communicating with families, and then there's managing staff. Staffing kind of sits in between business and pedagogy, but we're gonna look at it in this section. Next slide. So we know that child assessment is incredibly important for a quality program. Teachers have to be observing children carefully to understand where they are and where their growth needs are. And that then informs the process of lesson planning and individualized instruction. The problem can be that when teachers are spending so much time doing paper-based assessments that they don't have time to look at and think about and use the information that they're collecting. It's also the case that when all the documentation is in paper form, it's harder to share that information. It's harder to track that information over time. Next slide. By using online assessment tools, we know that teachers actually have more time to teach. We know that they can collect information and then have it right at their fingertips to be able to use that information to engage in reflective practice. Next slide. Family communication. It's always been important, but now I think we all really know that everyone is a little bit on edge, and being able to share information between families and programs is just extraordinarily important. Next slide. So being able to use parent engagement tools through smartphones, through apps, to be able to communicate with families regularly and often is critically important. Childcare management systems help programs be able to do that. Next slide. And then finally, staff management. So there's a lot of work that programs need to do, and providers, family childcare providers, need to do to stay current for their professional development, for their certifications, and managing all of that. Staff management systems can really help program directors stay on top of that. It can help family childcare providers document and track their own paperwork and credentials. It's just a really important tool in this work. Next slide. Let's keep going. So I want to show you a couple of slides that make all these ideas that we've just talked about a little more tangible. So what does success look like? Well, shared services, when it's done at a deep, impactful level, can have a real significant impact on teacher pay. So these are two pie charts that are from a real shared service alliance. And when the Shared Service Alliance got started, the personnel budget looked like the pie on the left. 48% of all of the resources were going into teacher wages. 35% was being spent on admin. That's people who are on the payroll to do things like do teacher payroll with paper sign-in sheets and all of the work that was required, prepare invoices for families, just all of the day-to-day tasks that were done with pencil and paper. 35% of the staffing resources were being eaten up through those tasks. I just find that an incredible number. And then another 17 is what we call support staff. Those are people like the cooks and the bus drivers and folks that need to kind of surround the program with those support services. So you can see that in the span of 1 year, they were able to reduce that admin number from 35 down to 24% and put all of those savings into teacher wages. Let's look at the next slide. So what that meant for this small program with about 60 children is they had $52,000 in extra money just in that year through their savings and through additional collections. The board of directors took that money and invested it in teacher wages. They set up an IRA program for a retirement program for teachers, and they increased the amount that they added to the amount that they paid for their health insurance. But the other amazing thing that happened was that the director had almost 2 additional days a week that she was able to now spend going into the classroom, because she wasn't having to chase parents down to pay their bills and all of the other things that had to happen. She was able to focus her attention on mentoring and supporting the teachers in the program. It had an amazing impact. And this was just the beginning. There were many, many more strategies for even improving the revenue that that program had available. Next slide. So what does this look like in family childcare settings? Here's a chart that shows, again, some real numbers that shows what happens to a program with and without shared services. This chart really focuses on the iron triangle. So you can see those 3 red bands. The first one is around the percentage of the market rate tuition. In other words, setting tuition can be a pretty daunting task for a childcare program, and having back office support to understand how to rightly price those services can make a tremendous difference. That second red band is around vacancy rate and being able to go from 25% down to 5%. And then tuition collections is the third. You can see the bottom line increase in revenue to this program is pretty amazing. Next slide. I want to play you a quick video clip from a colleague of ours. Monique Reynolds works in Atlanta, Georgia for the Quality Care for Children organization. And just by way of background, QCCC spent many years doing quality coaching for programs. And what they learned was they would go into programs and work on some issues, and then the next time they would go, that teacher would be gone because of a 35% staff turnover rate. That they could never quite get ahead of their efforts to improve quality in childcare settings. So they decided that they needed to launch a business support project as well. And their project included not only coaching, but paying for an initial setup and onboarding for a childcare management system, and then helping those programs start to utilize that childcare system. So let's listen. I asked Monique several questions, and I'm going to play for you her answer around impact. Let's hear from Monique.
So can you share with us a few examples of the impact of this work?
Yeah, so the impact has been absolutely amazing. So for example, at the start of our program, we were working with 40 programs, 21 centers, and 19 family child care providers. When we did their pre-assessment, we looked at their budget and their iron triangle model. When we put all that data together, the average bad debt at the beginning of the program was over $50,000 per program. The great part about this result is at the end of the program, going through the training, converting these programs to automation and looking at their data, looking at that iron triangle model, at the end, the average bad debt was roughly around $875 per program. However, most of that bad debt was zero for most of the programs. All accounts were current. Providers had more knowledge of their business, and they were collecting all of their monies on time every week, and so they didn't have bad debt at all. Another example would be their enrollment. Because they were focusing on their automation, and it streamlined their internal procedures, the enrollment on an average grew by 34%.
Let's go to the next slide. I'm running a little behind, so I'm gonna breeze us really quickly through here. So how do we get there? What are some of the barriers? Next slide. So the first issue that we need to know is that most childcare providers actually do not use CCMS or do not fully use it. Estimates are that 20 to 30% of the field uses CCMS. Next slide. This is a table that came from a state where we asked Childcare to pull the data on the back end. And what we learned is that even though 68 providers across the state were using Childcare, only 19 were entering any data, and only 1 was actually fully entering data. So the lesson there is it's not enough just to purchase software or encourage providers to buy software. We actually need to support them in using it. Next slide. This is kind of the pathway. This is the roadmap, if you will. This combination of using a childcare management system, combining it with business coaching, connecting it to a shared services hub, and that's what gets us to being able, having skilled financial management and then focused educational leadership. Next slide. And then Chelsea's going to talk some more about interoperability, but I just want to call your attention to the circle next to the list next to providers. That's a list of just some of the information of the data that providers have to collect all the time. And if we could take that information and connect it to our resource and referral systems and to our state data systems, we would be able to understand so much more about what's happening in childcare settings, really to inform our policies and where we need to go as a field. Next slide. This is a list of some resources. I'm going to now turn it back over to Chelsea, and we'll hear from folks that are doing the work.
Thank you so much, Sharon. Before I turn it over to our next presenter, Shannon, thank you for all the questions that have come in through the Q&A, and please drop more in that Q&A box on the bottom of your Zoom, and we'll turn to those in just a few minutes. But first, let's hear from Shannon Katsourotis. Shannon oversees the work of Nebraska Early Childhood Collaborative as its Chief Executive Officer. And prior to coming to NECC, Shannon was the President and CEO of Kansas Action for Children. Shannon.
Great to be here today. I'm going to affirm some of what Sharon just shared in my own lessons learned. Next slide, please. So just a few words about NECC to start. The Collaborative is a statewide nonprofit organization. We're focused on elevating the business of childcare, and we do that in 3 ways: business services and resources, partnerships, and educational supports. Next slide, please. We actually started our shared services journey at the Collaborative with deep shared services for 6 high-quality early learning schools that are part of Educare Omaha and Educare Lincoln. And for us, deep shared services means all of the financial and human resources function are contained in the hub, which is the Collaborative, as well as some of the professional development supports. So you see a list on the left-hand side of what those services look like. And then in the past 18 months, we've really extended our shared services journey to include a staffed family child care network, which is what you see on the right-hand side. We provide different levels of support for family child care providers across the state. This is actually a statewide function, as opposed to the deep shared services we provide for the large early learning schools, which is more of a localized function in the eastern part of the state. Our staffed family childcare network, while not the same level of deep shared services we provide for the large centers, is still very robust. It includes partnerships with All Our Kin, Ariana is on today, as well as with Wonder School, and includes licensing support, business training and consultation for family childcare educators, relying heavily on All Our Kin's model, as well as Wonder School providing the technology anchor for that network. Next slide, please. So I wanted to give you a sense of our growing footprint in Nebraska, because I think it underscores the need to have technology at the forefront of thinking around scale. So you'll see us over on the right-hand side, the far right side of the map. That's where the collaborative is located. And then most recently, we have expanded westward. And the little foxes you see, those are actually our growing family childcare network. That's really our logo for our family childcare network, as well as the All Our Kin business training and consultation hubs that are spread around the state. You'll see their logo, but I think it just really underscores reach from where we're at in terms of Omaha to way out there in Chadron and the Panhandle. You're looking at around 8 hours. So to be able to scale and reach providers in those communities, technology is a real necessity. Next slide, please. So I really want to touch on 4 lessons learned in terms of the work of the collaborative in our shared services journey, and I think they'll harken back to much of what Sharon already shared. I think first and foremost, whether or not you're doing shared services with large centers or with family childcare providers, we find the lessons are remarkably similar. When we started our shared services journey with the large centers, we didn't have the technology and systems in place. We had the privilege with our family childcare network of really putting technology at the forefront and thinking about having those systems in place before we launched that work. So I think really time well spent to think on the front end about your childcare management software or other systems you might need around your shared services work. And for us, this is really, we think this is important for 3 reasons. I think we've learned in our own journey in Nebraska, you can't provide cost-effective shared services, efficient shared services, or deliver the data that everyone needs to make good decisions without the technology and systems in place at the outset. I think second, what the map underscores is for us, technology was critical, whether we were scaling locally with large centers or scaling across the state of Nebraska. Without technology systems in place, scaling simply wasn't possible for all of the reasons I already mentioned. Not cost effective, not efficient. We didn't have the staff capacity to reach 8 hours across the state without those technology systems in place. I saw a question pop up in chat, and in part this may speak to this question. I think we recognize that for childcare providers, and it's certainly been our experience on the ground, and I wouldn't say it's any different for a family childcare provider than it is for large centers. We see different barriers to technology utilization, but barriers nonetheless. So in terms of our family childcare network, we have incorporated a fund that allows providers to access resources they may need to access either hardware or software, including their childcare management system. And we're doing some high-touch technical assistance to prepare providers for the utilization of those systems. And then lastly, I think sometimes this gets missed, and this has really been underscored as an opportunity in our work in Nebraska. Often the focus is on providers that have been in the field for some time. And I think in our shared services experience, we've really learned that there is a great opportunity with providers that are new to the field or early in their journey as providers, that they are more willing to adapt to new technologies, and it has been easier to focus in some respect from the beginning of their journey on incorporating a childcare management software and incorporating shared services into the way they do business every day. Certainly not to suggest we want to abandon the existing providers in the field, but I do think there is an opportunity to set the stage for success with new providers. In Nebraska, we're doing that through our licensing support work, so that as we're bringing providers on board with licensing supports, we're also bringing them on board with a childcare management software system and giving them the opportunity to engage with our shared services network. Chelsea, I'll turn it back to you.
All right, thank you, Shannon. So our next speaker today is Ariana Shapiro. Ariana is a business mentor coach at All Our Kin. She develops interactive business curricula to share with both trainers and childcare providers across the country. So take it away, Ariana.
Thank you so much. Happy to be here today. So let me just give a brief introduction to All Our Kin. We've been working since 1999 specifically with family childcare providers, providing trainings and coaching to support them both as educators. We have an education coaching program and as small business owners. And that business work looks like a 10-week interactive business series and a new virtual adaptation of that business series, a one-on-one business coaching program, a loan program, and a proprietary accounting system that's based in Excel. We're based in Connecticut and New York, but we do work around the country, technical assistance work, which includes a wonderful partnership that we've had with Shannon and the Nebraska Early Childhood Collaborative. At Allercan, we are so excited about the move towards shared services. We think there's tremendous potential to reduce the burden of business management. I think some of the data that Sharon showed really supported this. And so that providers can focus most on what matters the most, which we know is the children. What I want to talk about today is just to make the case that business training and coaching are essential and important complements to any kind of technological innovation and shared services technology. And I see three main reasons for that. The first reason is that business skills actually enable the most effective use of that technology. So training and coaching, part of why we think they're so important is that they're giving educators an internalized set of capacities and skills that set them up for success in managing their businesses using a childcare management system or some of the other tools that have been mentioned. And in fact, those tools are even more powerful when they're backed up with this deep business knowledge. So I'm going to try to provide a few examples as well from the work that we do. One example is record keeping. A lot of childcare management systems they feature very clever technological solutions that make the record keeping burden less so for especially for family childcare providers, who we know this is one of the big ones for family childcare. However, there's a gap for many family childcare providers around some of the understanding of business and expenses, what counts as a business income or expense, especially when there's a tricky territory of shared home and business expenses, thinking about rent or utility bills or some of those other kinds of expenses. So there's a huge potential for us to pair training with these childcare management tools to be able to enable the most successful outcomes. Another example that comes to mind is just last week I was leading a virtual class with family childcare providers, and we were talking about record keeping. And one of the participants asked a question about how to save receipts so that the ink doesn't bleed, so they can keep their receipts well for future years. And without me offering any information, other people jumped in. They started this spirited conversation based on some providers with many years of experience, other providers brand new, sharing their tips, best practices, and the different ways to keep those receipts. And that to me really stood out as one way that the training and coaching settings can support better use of these tools. So in summary, putting the tools together with the knowledge equals power for providers. The second point is that relationships reduce isolation and they support knowledge retention. We have seen relationships between family childcare providers who attend business trainings in particular create a sense of connectedness, a sense of long-term peer support far beyond the last class that the participants attend. Providers often self-organize to remain in contact years after trainings. They share resources, they share advice, materials, wait lists with each other. And these connections, we see them reducing isolation, encouraging more professional development, including professional development around their role as early educators, and ideally, hopefully, keeping providers in the field. And then also that deep relationship between a staff member and a family childcare provider can help support long-term knowledge retention of business skills. This is an idea we know is well supported by research, that coaching helps support knowledge retention. And if you think about a topic, for example, like a childcare contract, the transition from learning about contracts in a class setting to sitting in your kitchen during nap time with a coach or over Zoom, guiding you through those detailed decisions that you have to make about your contract terms. We see that as a really transformative process for providers. And finally, there are some skills that providers learn through business training that we see have a holistic influence on their success as educators and as business leaders. So putting aside some of the financial management tools that support the best utilization of shared services, communication skills, self-advocacy skills, those are empowerment skills. They help providers in their interactions with families, with children, and with the community at large. We also see providers changing their self-perception, seeing themselves as professionals and advocating for more recognition for the hard and essential work that they do. So these skills that they range from drafting marketing materials to giving tours to prospective families. And we've seen really exciting outcomes from training and coaching. One example that comes to mind is an activity that we do in our business series where participants have a list of questions to ask a tax preparer, and there's some volunteers that have been planted with some different answers to the questions. Some of them are serious and some of them are pretty humorous answers to the questions, and the group gets a chance to ask these questions and practice figuring out who is and isn't qualified to do their taxes. And at the end of the class, they often say that they feel much more prepared to have that conversation in real life and to hold accountable the person that prepares their taxes, their tax preparer. So the question is, one question that this leads to is, what does it mean to provide high quality business training and coaching that supports and complements shared services? And you can go to the next slide now. So I'm not going to go through each of the points on this slide, but in summary, what we've learned from our 20 years of experience is that training and coaching needs to truly meet family childcare providers, in particular where they're at, making sure that it's fun, interactive, and activity-based, especially over Zoom where it's so easy to tune out, making sure that content is specific to family childcare, which has a unique business structure and has some unique needs that aren't found in center-based care, engaging provider voice in the design process so that it is especially relevant and appropriate for their real lives, so that it's culturally relevant and available in the languages that providers in your community speak. And then embedding that relationship piece and that networking piece into all professional development, whether it's a cohort, series, or a peer reflection circle. And the last thing that I'll mention is that we, when possible, should pursue resources to incentivize business training and coaching and advocate for policies that make business training and coaching an integral part of each state's professional development system. So I could share much more about each of these points, but I will pause there for now and pass it back to Chelsea.
Thank you so much, Ariana. We're going to take a few questions from the Q&A here. Want to direct the first one to you, Shannon. This came from Martha about how programs have overcome digital literacy challenges in moving towards automated systems. And how much of a challenge is this? You started to address it, but would love to hear a bit more.
Yeah, so I think in our experience, we found that as more of the resources and tools that are out there become mobile first, where a lot of the work can be done on a provider's phone, the hardware itself is less of an issue than being able to navigate the program. And so or system. So in our experience, preparing providers on the front end with some technical assistance, even as we do more and more virtual professional development, including the business series at the moment, we're preparing providers on the front end, even on platforms like Zoom, so they feel very comfortable and confident before we actually dive into the substance. I think the same is true with the childcare management software systems. It's more about high-touch technical assistance on the front end and a person they can regularly touch down with to ensure they're utilizing that system than it is the actual hardware.
Great, thank you, Shannon. I'll ask you the second question, Ariana, from Elizabeth Ozer. Can you talk more about what strategies you recommend to build trust between participating providers?
Sure, I think that there's a variety of strategies that are useful for building trust. And I think this has been a really interesting question for us to think about in the Zoom context that we live in during this pandemic, but making ways for providers to engage with their real life experiences and feel that they have something to say, even if they're brand, even if they don't see themselves, and maybe they own themselves. So making sure that those actions are really valued and tied back to their role as entrepreneurs as well. And then I would say also providing a lot of opportunities for peer networking and making it very clear that providers are the ones with so many years of experience, that their voices are so valuable, and sharing between each other, I think we've seen that be really empowering, especially for people who are newer, to feel like they can take the risk and share something or ask a question or ask for help, whether it's engaging with a class or engaging with a new technology.
Wonderful, thank you. So Sharon, we've gotten a few questions about cost and particularly how cash-strapped childcare providers can afford this and what kind of some of the funding options are. Could you share a little more on that?
Sure. So there's one part of the question is, where do you go to find seed money to help create something like this? So there's no question that there are resources that are sort of needed upfront. And I think that you may be going to talk about that a little bit later. So let me address the issue around how much does a CCMS cost? How much does it cost to participate in an alliance? What are the fees for that? And can providers afford it? On the question of affordability, the whole premise of this work is that we aim to help providers do better, right? So the point of using a child care management system and the point of being in a shared service alliance is to improve revenue, to decrease your overhead costs, and to give programs more time to focus on education. So it's always the case that if you purchase a child care management system and you fully use it, instead of having to pay a person, the fees for that service are going to cost less than paying a person to do that task. That's the first point. The second, about how much does it cost to be in an alliance, if it's costing you more to be in the alliance than you are saving and bringing in, then you shouldn't be in that alliance, right? The whole point is to improve your bottom line. So I think that those are really important ideas for people to stay focused on.
Awesome, thanks, Sharon. Well, we'll dive more into funding with Sue's comments in a little bit. But for the moment, I'll transition us to part 2 of today's conversation. If you want to pull the slide back up. I'd love to start by reviewing the key takeaways that I shared earlier. One more slide. So our first 3 presenters have made the case, I think, effectively, that changing business practices directly affects child outcomes and that technology is essential to changing those business practices. So I'm going to focus on the role that states can play in enabling technology use. And I want to say this presentation is the result of a year of research that Sharon and I did together, focused on best practices for states' technology use. Building on our own experiences in the field, we had conversations with lots of state and federal officials, as well as shared services leaders, funders, and others. And I'm also grateful to Promise Venture Studio for giving me the opportunity to do this applied research as entrepreneur in residence. So in the next few minutes, I'll share why states have such a crucial role to play in enabling automation at every level of the childcare sector, from providers to shared services alliances and other intermediaries to systems. We've seen repeatedly that states can create real barriers to providers' use of technology when they don't understand and act on this crucial role. Next slide. So here's the big challenge. When providers try to automate, they are often blocked by the requirements of public programs. This chart shows what that looks like for a provider working with just one government program, the Child Care Subsidy. In this program, providers typically have to bill the state monthly to receive their payments, and that billing is often manual and duplicative. In other words, providers may automate and take attendance in an online system, but then they have to generate a separate attendance record for the subsidy, often in a different format, in a different system. Similarly, they might adopt a sophisticated accounts receivable system, but then they need to do that work a second time to bill the state. They might start processing their payments online, but then get a separate check from the state. And all of this is just for the subsidy. Then add the child and adult care food program, add licensing, add QRIS. Together, these are more than just inconveniences. These daily challenges accumulate to impact providers' decisions in ways that have major implications for our early care and education system. Shared services leaders can help providers use software to manage their business, but that software will have limited value if providers have to enter in all the information a second time in a state system, or even a third or a fourth time. So providers might say, it's not worth it for me to use technology because I rely on this state money, and then they lose out on better business practices. Or they may say, I'm not going to accept government funding, which means that families don't get the help they need paying for early care and education. Next slide. This is one major reason that so many providers are stuck in a cycle of unsustainable business operations. And it's a major reason that only 23% of eligible children are enrolled in the subsidy. But it doesn't have to be this way. States are starting to develop systems that encourage providers to accept funding. Next slide. Better systems start with the data that providers generate through their operations and put in their CMS every day. Providers are already generating the records that states need to process their subsidy payments, to track their licensing status, to manage the food program, and in some cases, even QRIS and assessment. Pulling this data directly from automated systems hugely alleviates the burden on providers and makes it possible for them to use technology while accessing the government funding that they and the families in their care need. And building connections between technology systems is not a huge technical challenge. It's really a people challenge. When state administrators and other key stakeholders understand and prioritize this opportunity, they can make huge progress with relatively few resources. There are tried and true methods for sharing data across systems in secure, private ways. These technologies are universal in many industries, including some with very sensitive data like credit cards and banking. And creating these data connections is also good for states. The most accurate, timely data is already in child management software. Every time we ask providers to retype it after the fact, we're introducing errors. And every time we create new systems to collect and monitor this data, we're putting state employees' time to things like checking signatures instead of supporting providers. Frankly, this is a waste of human potential. At every level in our early care and education system, we need people to spend their time helping children and families, not doing paperwork. So I would urge advocates and state leaders to approach interoperability from a human-centered place. What I mean by that is keeping the daily experiences of childcare providers and families front and center. You can help make sure that your state hears from providers and families when it makes decisions that might seem small, but which actually have huge implications. Things like what kind of reporting they're going to require when providers accept government funding, and even what specific questions they'll ask on the forms. Next slide. So Colorado has been a leader in technology use, and I'll share a couple case studies here. First is Early Learning Ventures CMS Software Alliance Core, which connects directly to Colorado's subsidy and licensing system. And that connection is open to other CMS software vendors as well. So for the subsidy, providers who use Alliance Core CMS can directly submit their attendance data to the state's attendance tracking system. This means that parents can do a single check-in every day instead of having to check their child in and out of two different systems at every pickup and drop-off. And that's removing a huge barrier to automation for providers who use Alliance Core. Next slide. Core is also considered compliant for the state's licensing system, which means that state licensing specialists can directly access Core to find the paperwork they need. They can easily identify and correct issues, which frees up time on their in-person visits to inspect classrooms and give technical assistance to providers, instead of using that time to look through filing cabinets. Next slide. Another example is in Missouri, where the state works with KinderConnect to collect attendance statewide to process subsidy payments. Providers have access to a KinderConnect portal, which on its own would be an additional system for the provider to work with. But KinderConnect has a data connection with many different CMS systems. So providers can directly push their existing attendance data from a CMS tool like ProCare or any other technology they use directly to the state for processing. Next slide. So these technology changes are critical to providers, and they're also critical to the early care and education system as a whole. With better information, we have a chance to get resources to the children, families, and educators who need them most. We can operate programs in informed, nuanced ways. Imagine what we could know if we had access to the data that we needed, which providers and families already create every day. We could know which childcare programs have openings and direct families to them. We could know which program characteristics are truly correlated with quality. We could know the credentials and pay of educators at the local level. And these are just a few examples. I'm sure all of us could double or triple this list with just 5 minutes of brainstorming. And I'm equally sure that we could all do better work with secure access to this data. Next slide. So if you're inspired by the case studies that we've seen, I want you to know that getting started in your state is not as complicated as you might think. It does not require you to be an IT expert. What it requires is you to listen to providers and families and build the will for making their daily lives better. I'd suggest a few specific steps that you can take. First, talk to providers and families who interact with these systems every day. They'll tell you exactly what the problems are, down to a bug in the state system or a confusing question on a form. Second, start to identify opportunities for low-tech pilots. For example, if you want providers in your county to submit attendance information from their child management software, you don't have to start with an IT upgrade. You can start by sitting down with your local R&R and asking if you can send them that report every month. Shared service alliances are great partners in testing new ideas like this, and the subsidy and other programs often allow waivers for these sorts of things. Third, map the vendor landscape. You don't have to build new technology from scratch. There are lots of social entrepreneurs and other vendors working to build better technology for states, providers, and alliances. And they can be great partners in bringing their technical expertise to marry with your subject matter expertise. So I look forward to discussing all of this further, but for now, I'll turn it over to Sue, if you want to advance the slides to Sue's bio. Sue Renner directs the Mirage Foundations, a consortium of 8 foundations and nonprofits in Denver, Colorado, with a focus on venture philanthropy. Sue provides strategic oversight for early learning ventures, among many other initiatives, and she also plays an integral role in Mirage Foundation's advocacy surrounding early childhood policy. So I will turn it to you, Sue.
Thank you, Chelsea. I'm really pleased to be here. Shared services is one of my favorite topics. I love to not only talk about what we've learned, but to be part of forums like this today allows us to learn from others as well, which is the exchange of ideas is amazing. We set about in this pathway for shared services for one specific reason, and it was our interest in re-engineering the childcare business model. We wanted to make sure that there was more supply of quality care. And when we spent about a year researching the childcare sector, we realized that it was almost impossible to deliver quality at the current revenue stream that was coming into providers. So the fact that we need to really re-engineer the business model and bring new tools and new technologies to these businesses was essential. Next slide, please. In 2008, shortly before that, we started sort of a learning path. We linked arms with the Annie Casey Foundation, the William Penn Foundation, and others to work with childcare financing experts like Louise Stoney and her team. What we decided through that work was that we were going to set about in piloting a model of shared services. And just to be really clear, I'm not sure there's been some questions in the chat, so I just want to really kind of state what we mean by that. What we mean by shared services is a robust support system for childcare providers that becomes a network for them. It lifts off the administrative burden, it amplifies their revenue, and it creates them with a way, as I said earlier, to do their business differently and more effectively. That does require, it's not just about moving the deck chairs around, right? It requires some new structures. And what our structure that we've been incubating in Colorado is called Early Learning Ventures. ELV is now operating in 6 states. They have over 600 childcare members. They also work with the Early Head Start childcare partnerships. And their primary fundamental belief is that it is a partnership, not a product. So while we've talked a lot about technology, I just want to make that really clear that the technology, the CMS system, is a tool that enables this partnership to function really, really well. And it enables the partnership to function at, we think, a really efficient level. There are some models of shared services that don't deploy a shared technology platform. The ELV model does. Next slide, please. Why invest in technology? I mean, we didn't set out on this road of shared services to be technology developers. Flat out, I'll tell you that. But we did. Over a decade now of investment into technology. Why did we do that? We did that fundamentally to increase the effectiveness of shared services and to keep the costs down. And we also wanted to look at it from a 360-degree perspective. We wanted to look at this CMS system as something that could bring value on all sides. And next slide, please. What I really want to highlight here, and I want you guys to walk away with a real clear understanding, is that a customized CMS system that is built for shared services, which the ELV model is, what that does is that creates a central core, a central data warehouse that then is used by the different partners in various ways. So the ELV Alliance system, the ELV members get a whole array of value from that system, but the ELV Alliance back office also has functionality and benefit from that system. And the key word, you heard it earlier from Chelsea, but the key word here is that interoperability. When the system is linked to childcare licensing, to childcare subsidy systems, it gives a value proposition that's much different than a system that is not linked. That leads us then to the next slide, please, which is, what is the role of philanthropy? I mentioned earlier this idea that it's not just a matter of rearranging the deck chairs that we're going to solve this childcare crisis. It really is about bringing in new systems, new ways of working. And I think that is the absolute sweet spot for philanthropy. As you guys know, government's not always the greatest with startup and risk that comes with that. But guess what? Philanthropy is. Philanthropy also has something else unique to bring to the table. Often philanthropy has business acumen, they have business experts, they have business tools at their disposal that sometimes our public partners don't. So I think that's something that I really want to inspire you to think about, is what resources do you have as a philanthropist that you can bring to bear? And one of the key things is seed funding. A question was asked in the chat about, how do these alliances get started? How do these networks get started? Well, very clearly, they do require some seed funding. The good news is, I think it's a lot less seed funding now than it was when we started this work in 2008. There's lots of models around the country that are looking to scale, that can be replicated. And so the seed funding, I think, is something that can range from starting a network of 10 providers, which would be a very small amount of startup, or a statewide network, which would be a more significant investment for the seed funding. The other thing you can think about in philanthropy is incubation, like we've done with ELV. Do you have room in your office? Do you have space that you can donate to an organization to help it get going? Remember, what we're talking about here is a back office. So it's not hundreds of staff members. You know, you're talking about some finance experts, some technology experts. You can create some space. You can do some incubation with that. The other thing is the technology platform customization. And I want to emphasize that word. I think we're past the place where you really need to think about developing a brand new, very customized system. I think you can build off of what's out there, and I'd really encourage people to do that. Next slide, please. The other thing is beyond startup, if you could go back a slide, please. Thank you. Beyond startup, I think we also have to think about sustainability. And this is an area where I think philanthropy has a huge effect. If you're not into startup and taking that risk, I appreciate that. But in terms of sustainability, there's a role. If you're an early childhood funder, very, very seriously think about dedicating some of your funding to a membership in an alliance. And I want to highlight the word here, partial, because what ELV has learned is that when an alliance membership is completely free, completely subsidized, it de-incentivizes the active use of the benefits of that alliance. So a partial membership stipend, maybe a gradual decreasing of that over time as the provider starts to realize the benefits of membership. It's a great role for philanthropy. Another important role for sustainability is national networking. There's national shared service conferences. Of course, there's IT sorts of conferences and shared learning. Really, really want to encourage philanthropy to help support the costs of that shared services ecosystem in this country and what that means to keep that strong. And then lastly, my first slide referenced the point that we're involved in policy reform. As a foundation, we are deeply engaged in state and federal policy for reform as it relates to childcare affordability. In policy reform, there's a real specific role right now around shared services. And more of the childcare quality improvement initiatives and bills that we're seeing, both at the federal and state levels, are including some sort of a component about shared services and childcare networking. And so there is a role, if you're involved in policy reform, to think about how you can help advance access to shared service alliances for all providers. It was certainly our goal when we set out on this path for shared services, is that one day any childcare provider who wants and needs this type of support can access it. So policy reform is really important to that. And I would just close by just emphasizing that really believe in networking providers, but also making sure that we have the human touch there as well. All our kin emphasize that, the Nebraska Alliance emphasize that. And while technology, I believe, is fundamental, I also really truly believe in the human side of shared services. Thank you, Chelsea.
Thank you so much, Sue. So we'll open it back up for Q&A again. Got a great question from Martha, which I would love to throw to you, Sue, but open up for the group as well. She was wondering what the connection is between shared services and this set of priorities that we all have and the broader movement to support increased funding for universal childcare. You started to touch on this, but would love for you to elaborate a bit, Sue.
Yeah, absolutely. I think first and foremost, it comes down to the trust that childcare providers have with the investors, and whether that's our taxpayers or whether that's philanthropy, you know, making sure that the providers have the ability to do their work really, really well, so there's no question about the trust. And then I think that's then the dollars flow. And so being part of an alliance, I think, improves the quality, improves the sort of bond that we have with the investor. And there's no question then that the work is being done really, really well. So that's why I think that's important. And then also, as the dollars increase, we want to make sure that the investors, again, whether that's the taxpayers or philanthropy or parents, we want to make sure that the largest portion of those dollars are going to the children and families and the services, and not to the administration and the regulatory burden of those programs. So that's, I think, another really, really good case for shared services.
Wonderful. Sharon, Shannon, or Ariana, anything to add on the connection between shared services and this broader push for more funding and more universal childcare?
So one thing that I would just jump in and say is that we have a little bit of an example in the Head Start childcare partnerships, right, which are designed to bring additional funding and resources to childcare programs. But if supports are not in place, this is a question about capacity and the fact that a lot of our childcare programs are very small, independent, or in the case of home-based providers, they just don't have capacity. And at the end of the day, is it fair to ask somebody to be both an excellent educator and an excellent business, small business manager? And so shared services allows for both of those things to happen, and it gives an infrastructure in places where it's needed. So I think we welcome additional resources, and we'd love to have a system where providers could really use those resources in the best way.
Thank you.
And Chelsea, oh.
Go ahead, Shannon.
I would just add there, I think one of the other ways it can really be an asset around the push for additional resources for childcare right now is the wealth of data that comes with shared services that we don't currently have about the business of childcare.
That's a great point.
I wanted to just add one quick thing as well, which is that through a shared services network and through those relationships with providers, we've had a lot of success in actually being able to go, in our case in Connecticut, particularly up to Lobby in Hartford, and bring providers with us or bring families through our Early Head Start partnership. And that's been really impactful in our ability to push for policy or legislative changes that support providers across the state. And we've also gone with providers down to Washington, D.C. as well. So I think there's a real opportunity as well to center provider voices in policy reform.
Absolutely, that's very well said. Would love to address kind of a whole set of questions we've gotten around where do we start, whether you're a funder or a potential alliance leader, different folks in the audience here. What are some of the first steps people can take? And could you kick us off with the answer to, or your answer to that question, Sharon?
Sure. Well, it's hard to imagine any business sector in the United States operating without technology. So making technology, business software accessible and affordable and able to be used is really critical. We have to move the needle to get more providers automated. And I completely agree with Sue that this really isn't, at the end of the day, it's not really about technology as much as it is about people, and people being willing to change how they do things on a day-to-day basis, being willing to build partnerships, all of those pieces. So I think those are both really critical elements.
Thank you. Sue, Shannon, or Ariana, anything to add on the how we get started question?
Yeah, again, I just want to emphasize sort of building off of the ecosystem that's out there. There's a lot of alliances that are up and running that are really willing to share their information and be good partners on helping other organizations start up. I also think as funders on the call, I think it's really important to think about the business model of the Alliance. So we're talking about the business of childcare, but let's make sure that any alliance that we're starting up also has a really solid plan for how they're going to scale and sustain their work. And to Sharon's point earlier, it's not about charging providers a fee that is going to destroy them. So, you know, I would caution a little bit about that too, to make sure that you're helping fund a startup of something that is sensible.
Thank you. I think in a minute, we're going to have a poll appear on the screen. So I just want to encourage everyone to give us your feedback. We'd love to hear how we did and how we can keep improving. I'll share one more question here. Start with you, Sharon. How widely available are shared services, and can all different kinds of providers participate, or who would be kind of a good candidate here?
Well, the best candidate to participate in a shared service alliance is either a home-based program or a small center that is struggling with capacity issues, right? There just aren't enough people to do all the jobs that need to be done. They stand to benefit the most. There are alliances all across the country, and there are, well, ELV is a great example of an alliance that is able to expand and move into geography where there are not alliances right now. So, so there's a map on the Opportunities Exchange website that sort of shows you the lay of the land. I will say this, the shared services movement has been around for close to a decade, but it is really, I think we're finally starting to get to some critical mass, and the pandemic, just like it's revealed lots of places in our society where we have issues, we see right now that childcare is really in a crisis, and shared service is a terrific way to start to meet the needs that have been exposed by COVID.
Thank you very much. Well, thank you for all of this amazing discussion, everyone watching at home and all of our panelists here. Sierra, if you could bring up our final slide. I'd like to start to wrap us up here by bringing back up the key takeaways that we shared at the beginning that we hope you have an understanding of coming out of today's session. First, changing business practices through shared services directly affects child outcomes. Second, technology is essential to changing business practices, and increasing the use of technology is a really important pathway to scaling shared services, what Sharon was talking about in that final question. Third, that states have an important role to play in enabling technology use at every level of the early care and education system. And fourth, that philanthropy is essential risk capital. So we'll wrap it up with a final word from each of our presenters today. Any last comments that you'd like to share? And we'll start with you, Sharon.
Well, I was actually just typing an answer to the question about policy reform. So I think I'd like to kind of say that out loud. I think that it's incredibly important that we take a look at the whole system, and that we start to move in ways that connect both provider tasks and data with public systems. And I mean by that resource and referral systems as well as state systems. One quick example of policy reform, if states would accept electronic signatures from some of these systems, it would make everybody's life so much easier. So that's just one quick example.
Thank you. Here on electronic signatures. Shannon, any final comments to close us out with?
Yeah, I think I would just leave the group with the thought that childcare is definitely a complex and highly regulated business, and technology and business automation are a necessity, not a luxury.
Thank you. Ariana?
Sure. I just wanted to say that I'm excited to think about all of the possibilities and ways that we can pair some of these shared services technologies with trainings. And I know we've talked a lot about ELV, who's an organization that we're going to be partnering with soon, and they'll be leading our business series with the providers that are also using that technology. And so I think that's an example we're really excited about. And I think there's a lot of other ways we could continue innovating and seeing how we can really have the best impact for providers, families, and children.
Yeah, that's a wonderful point. Sue?
Yeah, that's a great point. I think sometimes mashing up some of the existing really best practices that are out there is really a cool opportunity. I just want to leave with a thought that the way that we view shared services is that it makes childcare businesses big where it counts. So in terms of their administration, their finance, their regulation, but it keeps them small and intimate and in neighborhoods. Family childcare particularly, it sort of gives them that wrap that we're looking for. So when I talked about re-engineering childcare, I want to emphasize that we want to keep the best of what's out there with childcare, particularly family childcare in small centers, and just make them big where it counts.
Thank you. Yeah, I would close by emphasizing Ariana's point that so much of what we've talked about today is really mutually reinforcing that kind of high touch one-on-one or group business coaching and the use of technology and the advocacy movement to increase funding and change these systems. All three of these things really complement and reinforce one another, and all work best when we're starting with providers and families and centering their ideas, needs, questions, and priorities. So thank you all so much for your presentations and all of you for your wonderful questions and comments in the chat. And I will turn it over to Jill to close us out.
Thank you so much, all of you. I've been listening to the last 90 minutes and just really thinking how special and powerful it is that all of you work. It's that this shared services effort and initiative and movement is that we're able to bring all of you together in this way to present different perspectives and different views and looks at this topic in a way that's really going to move the entire sector and the entire movement forward. So I'm really glad that we've been able to continue this learning conversation with our first session in July, with this session, and we're starting to think about even having a third conversation, continuing this topic of shared services. So we encourage everyone to continue to stay with us as we think about what that third one will be. Just want to reiterate our GLR Learning Tuesdays webinars that we have coming up, including today through the end of the month and then into November and beyond. We will, if we didn't get to your question and you posted it in the Q&A, we're going to try to send written responses to anything we didn't quite get to when we send out our post-webinar information, which will also include several other resources that our speakers have so generously offered. So be on the lookout for a follow-up set of resources and summary of this conversation that CGLR will send out. And with that, I really want to thank Ariana, Sue, Shannon, Sharon, and Chelsea for just putting together a really informative, productive, high value add discussion, and to all of you for posing really good questions that help continue our learning process as a whole. So thank you. We hope to see some of you at GLR Learning Tuesdays coming up later today. And if we don't see you there, we'll hopefully see you very soon. Thanks so much. Stay healthy and safe, and I hope you enjoyed this conversation. Take care.